Hello and welcome to La Nouvelle Medical Spa. My name is Dr. Hanna. I'm board certified in cosmetic surgery, and we're going to talk today about one of the hottest topic on the market. We're going to talk about Voluma. Voluma is a filler. So why would anybody actually want a filler? Thank you, Mia, for coming today, and Mia is going to have Voluma for a filler. Now, why would anybody use Voluma, or why would you want to have a Voluma in your face? Are you a candidate, or do you think that you'll get something out of the Voluma? Well, the reason is, look at the mirror, and if you feel that you started losing volume, and most of us, where we lose volume, it's really the middle of our face. So it's mid-face. And it's very much indicated, really, it's very popular when it started really in Canada, really to get that middle face volume back to life again. So you look more pretty, more beautiful, more volume. So that apple of the cheek becomes more pronounced. And when that apple of the cheek becomes more pronounced, the middle of the face really comes to light, and people will look at you, the eyes get drawn to that middle of the face, they look at more beautiful face. So that's one of the reasons why people would use Voluma. Well, how long would it last? It can last up to 2 years. So this is our first long-acting voluminizer or filler that we can use. What is it? It's hyaluronic acid, so it's very safe, it's been approved by the FDA, and most of the indication is really for the middle of the volume. Where do we put it? Well, we put it right on the bone. So we don't really want to have it look artificial. So we really want to put it really deep. It lifts up the tissue, so your tissue are looking normal. So any eyes looking at you, they will look at your natural tissue. They will not really be looking at the Voluma filler. But the Voluma filler will be helping that tissue to look their best. So let's start. So I just want to show you the difference now. We have just like maybe 4 injections on the left side, and how that lifted out the cheekbone, and you can just compare it, the left side from the area that on the right side that has not been done. And you know, in a minute we're going to give me a mirror and she can see for herself, but that is half of the injection. And so it doesn't really take very much really to improve the figure over the face around the middle part of the face, which is the cheekbone. And as you can see, nobody can tell that she's unusual or out of proportion or odd looking. She's looking absolutely natural, and the cheekbone has been just lifted up, and the lifting up you cannot really see it because it's so deep. So what your eyes are seeing is really the natural tissue, which is the normal tissue of your bone. So when people look at you in the street or work or shop, they just look at your natural look, and they will look at you, but they will never really know that you have something there that lifted up and got you, maybe 5 or 10 years younger. And that's really the idea of the Voluma. So let's keep going. So now we just finished another syringe of Voluma. So we put one syringe on the left side and we put one syringe on the right side. And as you can tell, when you look at the face, you really don't have any black and blue mark. You're not bruised. You can probably just put your makeup and go straight to work. So it's really not a big deal for the Voluma. It's really kind of like 15 or half an hour, at maximum, and you're back to work. And all what we're really seeing right now is just probably the last shot that I have, which is just kind of like getting me. You can probably tell where I had my needle by looking at that spot, but you just put like a little pressure, very gentle, for about like maybe a minute or two, and she would be ready to put her makeup, her powder, her sunblock, and back to work. So how bad was it, Mia?
It's not bad at all.
Not at all. Okay, we're going to give the mirror now to Mia so she can see. You can see the results right away, and let her be the judge. What do you think?
Oh wow.
She said, oh wow, so she must like it.
I can really tell a difference.
Exciting, huh?
Yeah. Thank you, Doctor.
Oh, you're welcome. So what we did really is just to bring back the contour that she originally had over the cheekbone and over that maxillary area, and just bring it back to life. Now, how often do you have to do that? If that will last you for 2 years, that's a good deal. Now, if that doesn't last you good, 2 years, and it will last you maybe a year and a half, that's still a good deal. And for a makeup that will disappear in 24 hours, I think if a filler will last you like a year to 2 years, that's a good deal. All right.